coming in the bedroom. I see I have a doctor's order. I'm just making sure, confirming it's for morphine and Tdap. Looks good. We'll go ahead and start prepping. My hand hygiene. I'll put on one glove for now just to make sure I'm wiping this down. And not getting any bleach on my fingers and such. So, like that. Just wipe this down, get this nice and clean, get all the gunk out. Okay, looks good. Dispose of that glove. Once again, I'm just reaffirming morphine, Tdap, looks good. I'm gonna put a paper towel in there. And hygiene again. Gloves out, they'll cooperate. Okay. Alright, so the first thing I'm going to get is the Tdap. I'm just going to check in with the Pyxis and the med orders. I'll pull this out. This is a pre-prepared vaccine. Get the med tray. Okay, looks good. That's the right dosage. Tetanus, 0.5 milliliters. IM only. Okay, looks good. We'll be this in the deltoid, so I'm going to get the 1-inch needle. Pull that out. Take off the stopper. That's there for now. Keeping that in a Holy Land. I'm not touching that tip now. I'm going to banana peel this down as such. Connect them without touching them. Screw that in, pull that off, that's done. This is now prepared, I'm going to place that in there. Also going to get a swab cap. Lots of alcohol swabs, just going to be too prepared. Next thing I'm going to do is the morphine. Checking the dosage, make sure that's right. I'm going to get out a syringe, 3 milliliters. Blood filled. And I'll get a cap for that because it is not going to be push. Go to the Pyxis, once again checking for morphine. There it is, 4 milligrams. Just touch my stethoscope, so I might have to change those, but for the sake of time, I'm going to keep going. Okay, gonna get this out. Banana peel it down. Good. And a blood fill. Pull that out. Connecting it without touching them. Looks good. Take this one away. Alright, making sure once again, 4 milligrams morphine. Pull that off. And I'm actually going to charge it real quick, so I'm going to pull back. I'm taking 1 milligram, or 1 milliliter, would be 4 milligram dose. I'm going to pre-charge this. Push that air in. Okay. Invert it. Keeping that needle below the line. This is a single-use vial, so I'll be drawing all of it. If I had any waste, I would have to ask another nurse to come in just to verify that I'm wasting it. But this is a single-use, so I'll be taking all of it. Do an air bubble. So I'm going to go ahead and push that back up. Make sure I'm getting rid of everything. A little bit of excess, we'll push that back up. Look at all angles, 1 milliliter, looks good. Pull that straight back out, put that down. I'm going to do one-handed recap, as such. Just like that. Put that back on, twist it off, and I'll go in the sharps. Next, now it's staying at the Holy Land, so I'm going to keep that safe. Pulling off a little blue cap. Once again, not touching it, I'm going to insert, twist, and now that it's safe, I can go ahead and put that in my med tray. Okay. I'm also going to take the morphine with me just so I can educate the patient. Looks good, and scan that as well. Don't believe I need anything else. Oh, actually, you know what? I do need a label for the morphine. So, just going to make sure. Morphine dosage is 4 milligrams. My initials and date and time. Put that back there. Pull this out. And on the bottom of the syringe so I can still observe the fluid level. Okay, now that's good. Perfect. Take my gloves. I'm also going to take a Tdap information sheet. Oh, you know what? I would put that gloves back on just so I can make sure I have the flushes ready. just gonna do one glove this time, so I can do it one-handed. Go back to the fixes, pull out my 2 flushes, check for no air bubbles, they look good, okay? Do that on my tetanus information sheets. I'm gonna bring a simvid dressing just in case. You never know. Okay, everything looks good. Go and go to the patient's room. All right, knock, knock. Hello, Mrs. Cison, how are you?
I'm good. A little pain.
Little pain right now? Yeah, I know you had an accident. Did you say your pain is still at 10?
Yes, it's excruciating.
Excruciating, okay. So I'll do a couple things for you today. I am going to administer some morphine that will help with the pain, and I'll do that first. Before we do that, though, I'm going to do my hand hygiene. Can you go ahead and confirm your name and date of birth?
Mary Cison, and it was April 1st, 19XX.
Okay, that matches up with your armband. I'm going to go ahead and raise you up. And do you have any allergies that I should be aware of, especially to like something like latex or cleaning chemicals, chlorhexidine, and especially in medication allergies?
I'm allergic to a couple of medications, ibuprofen, penicillin, and medenapine.
Okay, I'll raise you up just a little bit. I'm going to do my hand hygiene again. Before I give the morphine, I just want to make sure we're reaching, I do have your vitals from the time they were taken, but I want to make sure they're consistent. So, just going to hand hygiene. My gloves. We'll go ahead and take her pulse real quick, Miss Cison. What I'm actually doing is I just want to also assess her respirations. I don't want her to change her respiration, so I'm going to pretend, I'm not pretending, but I'm going to take her pulse as well. Just watch her breathe, making sure. I notice she's breathing kind of rapidly. I do 30 seconds, then multiply by 2. She's doing 22 respirations a minute, which is a little high. I'm also going to do her pulse ox. So I have that right here. Get my swab, which is just your oxygen saturation in your blood. Doing this really, really well. A lot of friction, especially in the inside where her finger will be touching. Make sure she's not contaminated with other patients. Okay, it looks good. Let that dry. Place it on her finger. Pulse ox is at 96, which is good, though with her rapid respiration, it's still something to think about. So record that. Her pain's still high, so I'm going to go ahead and start giving her morphine. I'm going to do. So now I'm signing in, checking this in. Okay, see the order again. My other glove. Okay, looks good. Go ahead and scan the armband. Looks good. Go ahead and scan the morphine. Beep. Once again, now triple checking against the order and fixes, or not fixes, just the order. Okay, looks good. Right dosage. I'm going to pull this dressing, your gown back. Inspect this side. I do notice the simvid dressing is a little messed up, so I think I'm going to address that after I give the medication. I'm going to go to the distal lumen. Get that clamp is way up there. Move that down. So, that's the case. Okay. And is this area sore? I am also observing this area as well. I'm palpating my wheel just a little bit. Is this area irritated at all?
Nope, I'm all good.
Okay, so I'm going to start giving that medication. I have this here. I have 2 flushes and a morphine. Now, the morphine might make you a little bit drowsy, lethargic, and also might make you just a little dizzy. So try not to get up at all. If you need to get up to do anything, please use your call light, especially call me. I will come assist you. Might give you some constipation, that's kind of expected. So it'll have you stay very hydrated and drinking lots of fluids, as well as having a nice fiber-rich diet, which will bring it up for you. You also might experience something that we would want to watch out for is respiratory depression. Any changes in your respiration, especially a drop, I want to make sure we're observing that. If you experience any of that, please call me. I will come check on you anyways, but if you experience any sooner, please use your call light, let me know. Other than that, any other effects, just let me know. I'm going to start cleaning up this lumen. Like I said, I use the distal lumen. take off that swab cap. Okay. Now cooperate with me. Okay. Clean, 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 clean. 15 seconds, make sure it's nice and clean. One over there. Okay. Now that I've cleaned that, I'm not going to touch that tip again. I'm going to pull out my flush. Once again, just assessing that there's no air bubbles. Maybe just push it up just a little bit. Okay, looks good. I'll push that in. And just a nice and steady push, pause, push, pause. Oh, I'm sorry, I did not unclamp. I should definitely do that. Okay, so unclamped, push, pause, 10 milliliters. Okay, looks good. Pull that out, that's done. Open up another swab. I'm cleaning again. Clean, 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 clean. 15 seconds. Let that dry, nice and thorough. I have the morphine. I did scan it already on the vial. I'm going to check again the right dosage, right strength. This is the right. Anything else? 1 milliliter. Looks good. I've already cleaned it, so I'm not touching it. I'm going to go ahead and pull that blue cap off. Insert like that. This is going to take, this is morphine, so I'm going to push it at a very slow rate, about 1 milliliter for about 2 to 4 minutes. So just very nice and easy. Might just twist it as I push. During this time, I'm also going to be inspecting her, like anything else. Like I said, I did notice her dressing was messed up a little bit. I might document as well in between pushes, say that I am administering this medication. Okay, did that. Push just every now and then, very gently. I've also noticed that she has abrasions and contusions on her arms, so I'll address that later as well. I'm going to assume 2 to 4 minutes has passed and I've finally administered the full medication. Okay, that's good. I'm going to disconnect that. It's done there. I'm going to clean one more time, open up the swab. Clean, 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 clean. And my last flush right here. Okay. Like I said, I'm just going to make sure there's no air bubbles once again. Looks good. Push that on there. I wouldn't be touching that after I cleaned it, which I didn't. Stay right here. Gonna do the first 2 to 4 milliliters, the same rate as the morphine. So I'm gonna push that in. Also, I did not aspirate on the first flush, which I'm just kind of rushing. I would do that, of course, and have blood return come into the lumen, but I just wanted to address that now that I've realized that. So I'll do the first 2 milliliters, the same rate as the morphine, and after that I can do the regular push-pause technique. Push, pause, push, pause. There we go. I clean one more time. I open up a new one. And then I would have a new swab cap put on. Save time. I'm just gonna put the old one on. That just keeps out dust and keeps it clean. Okay, and then most importantly, I'm gonna shut the door, making sure that's recapped. Okay, looks good. Make sure that's just covered up a little bit. Next thing I'm going to administer is your Tdap vaccine. Unless you got one, you did have it cut against a metal object, maybe your ladder. So I'll make sure that we're giving you a tetanus shot. This is Tdap, so it's for several things actually. It's your tetanus, diphtheria, and pertussis. Pertussis is just whooping cough. I've recommended that adults get it every 10 years, so I've seen through my history that you should be getting one. You'll be okay receiving the Tdap?
Yes.
Okay. You may experience, I'm going to give this in your shoulder, you may experience some stiffness, pain, redness, or swelling where the shot was given, some mild fever, headache, and just general lethargic feelings, nausea, vomiting, diarrhea, stuff like that. And you may also experience just being a little faint or dizzy. All those are pretty normal. And then also do notify me even after I leave if you experience any allergic reaction symptoms, okay? After we're aware of all that, are you still okay with receiving the Tdap?
Yep.
Okay, perfect. You can also look over the sheet while I get this ready. Do my hand hygiene again. this one more time. Scan this vaccine. I have right here. Looks good. Check against the meds. Looks good. I'm going to come over here. So we're going to be on her shoulder. I'm going to assess the area. So I'm going to find her deltoid. Make sure I'm palpating the area. It's a nice, good spot for a muscle. Find a good spot where the belly of the muscle is, where it's a nice deep injection. So to do that, I'm going to landmark it. I'm going to find the acromion process with my ring finger, 2 fingers down, and right in those middle is where I'm going to give it. That's a nice, fun place. I'm also assessing the area just for like any scars or anything that I should be concerned about. It looks great, healthy. I've landmarked it. And I'm going to ask the patient to get in a nice, relaxed position. So I might have her sit up. She's fine the way she is. And she's nice and relaxed. So now I've done that, I'm going to take my vaccine. First, I'm going to clean the area. Clean, 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 clean. 15 seconds. Let that dry. While that's drying, I'm going to assess the needle, make sure it's still good, nice and straight. I'm going to Z-track, so pull that skin back, right in 90 degrees. There we go. And just like that, all the way in. I'm going to anchor it, and then nice and slowly just push that medication in. All the way in. Okay, wait 3 to 5 seconds for it to seal so it's not dripping out when I pull it straight back out, undo the Z-track, safety mechanism, engage, and that will go right in the sharps. If I had any bleeding, of course, I'd put like maybe a cotton swab in there and also a bandage just for her own protection, okay? So that's what I'm going to do. Like I said, your simvid dressing change. Maybe kind of concerned about. You could also document and save that. Okay? I'll pull this over here, just like that. I'm going to do, actually, I'm going to clean this area first, because now we're going to be very sterile. I'm going to put this rail down with this hand. Even if I did touch it with my gloves, I would change the gloves, but in this case, I think I'm fine. And I am leaving the area, so just for a second, be careful not to get up and don't fall. You know, if I have a bed rail, then I don't want to make sure the patient's at risk of fall. That's clean, that's drying. Like I said, I'm turning my back, so please be careful. My hand hygiene. Pull this over here. Okay. Okay. So you have a mask for you, Miss Cison. I'm going to have you put your head this way to the left. I'm going to put this on you because I don't want you breathing on the side, especially when I expose it from your dressing. I don't want you breathing on it, making it infected. This needs to be very aseptic as possible. So I'm just going to turn your head, put this mask on you. Thank you for cooperating. Put my mask on, of course. I have my gloves right here. Do my hand hygiene again. Pull those out. Same within the 1 inch border. Looks good. Let's take a step back and pull this right here. Actually, I would start with my dominant hand, so I pull this right here. Take a step back. Okay, looks good. Come over here, you can do it on the cuff. Okay, take a step back. Doing my hitchhiker's thumb. Open that cuff. Hitchhiker's thumb. Okay, there we go. Okay, like I said, I would palpate the area, make sure it's nice and not tender, no irritation, looks good. I'll start peeling this back up. Okay. Assessing the lumens, they're all clamped. I just change them. Okay, that's now done. Put those away. And then my hand hygiene again. My new gloves should be in there. They're not in here. I think I have some right here just for the sake of time. Okay. Thought I had a second pair of gloves. I do not. Check real quick here. Here they are. They fell out in my backpack. would wash my hands. Okay? I'm going to pretend that I found this in there. Have that right here. Okay, staying within the 1-inch border, pinching out.
10 minutes left.
Okay. Looks good. I've established my 1-inch border that has a little bit of overhang, touching the 1-inch border. Come over here. I'm keeping the sterile field in sight and the patient. Okay. Grab this glove. Oh, I'm sorry, I touched on the cuff. So starting over, I'll grab right here, pull that up, take a step back. These are a little small. My hands are now above my waist. I can touch above the cuff now, which I didn't do the first time, which I would get new gloves in that case. I'm not taking a step back, pull that over the hitchhiker's thumb. That's okay. I'm just keeping the sterile field in sight. I'm going to move that with my foot. Okay? First, I'm going to take the chlorhexidine swab, pull that straight up. Did touch the sponge just a little bit, but that's okay, I'm sterile. Initiate that, let it flow down and soak up. While keeping the sterile field in sight, I'm going to come here and just scrub really, really vigorously. Good, 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 good. All around the side especially, and then around, coming out from the area underneath the lumens and then straight down lumens. That's good, I can throw that away. Okay, she does not need the skin barrier, so that is okay. I'm going to go ahead and apply her bandage. Come over here, pull this straight up, just like that. Keep it above my waist. Let me go ahead and pull this back. Oh, I'm sorry, that is not the right order. I can go that way. And just like that, I'm going to lay it straight down. There we go. I think in the future I'd also remove the pillow just to be safe. Okay, make sure that's nice. Okay. Pressing down as I go out. It's a little bit messed up. I would try again if it messed up any worse. Okay, the sterile field is now done, so I can go ahead and do this. Pull up my pen, initial, date, engage. Okay, and place that on there. And as well, I'm going to ask that you stay very cautious of this dressing this time. If it's irritated, try not to itch it. Don't get it wet, especially. And if you see any, if it's disturbed anything, please call me and I'll come change it again for you. But just for the sake of keeping it on there nice and not infected, because it is going straight to your heart. We want to make sure it's as clean as possible. So try not to mess with it. Don't get it wet. Any assistance you need, please give me a call. Okay? I'm going to dispose of my gloves. This is done. Okay? And last thing I'm going to do is I'm going to do a quick assessment real quick. Do my gloves. So as you said, your pain is at a 10. Is it still right there?
Yeah, it's still kind of a 10 right now.
Okay, I'm going to remove your mask as well. You don't need to have that on anymore.
Oh, thank you. Yes, it was so uncomfortable.
I'm sorry about that. Thank you for cooperating with me, though.
No problem. We got to keep each other safe, right?
Yes, exactly. So I'm going to assess the injury site. Okay. You hurt your ankle. And you see it's wrapped already. That's good. I'm going to take a pair of gloves. So I know you probably have limited range of motions. I won't make you move anything if it's super uncomfortable. Can you go ahead and push against them? How about just this foot? Okay.
Oh yeah.
You're gonna come back. And just want to check, make sure there's no cross or anything. Can you just wiggle these toes?
Wiggle, 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 wiggle.
Okay, I won't make you move it too much if that's uncomfortable. I'm also going to check your pedal pulses really fast, just make sure they're equal. Okay. Sounds good. I'm going to check them up here as well on your arms, just to make sure I'm staying consistent. Your hand hygiene, because I just touched your feet. I don't want to touch the same one with the gloves. Pulses equal. I'm also checking the arms for any, I know you've had some abrasions and stuff up here. I'm going to cover you back up. But nothing too concerned about. I'm going to check her cap refill on her fingers. And then once again on her toes, do a quick pinch. Okay, just touch her toes again. I'm going to wash my hands. I'm also going to quickly check her temperature, especially on her extremities. Experiencing any extreme cold anywhere? Just the back of my hand.
No, I'm good.
Some normal temperature. Looks good. And are you experiencing any numbness, tingling anywhere that I should be really concerned about? I know you have some pain in that foot, but anything like numbness, tingling, anything like that?
Oh no, it's all normal or painful.
Good, good, good. Okay. Alright, Mrs. Season, I'm also going to, I got everything, check your pain. I'm going to document and save this. Document and save everything I did, especially meds, we did a simvid change, and we give you a quick peripheral neural assessment. Put this back down and let this rest. Make sure you're nice and comfortable. You have your pillow. It's comfortable. You have your call light in your hand. Do you need to go to the restroom or anything?
No.
Okay, I'm going to go ahead and raise this back up. Okay, and lower you back down. Might be a quick jolt. There you go.
Ooh, that morphine's kicking in.
That's good. How would you say your pain is right now?
Oh, maybe like an 8 now. It's working.
Okay. So I will also be constantly coming to check on you, especially for the hip or respiratory changes. But if you experience anything suddenly, just always give me a call right ahead. I will come run to you and help you out, okay?
Okay.
Anything else, possessions I can give you?
No, the call light's good. I'm just gonna take a little nappy nap, I think.
Okay, okay. And you don't need to go to the restroom or anything like that?
No, mate, sir.
All right, I'll go ahead and clean up and get out of your hair. Thank you for cooperating with me. I know it's kind of a process. Like I said, my name is Jonathan. If you need anything else, give me a call. I'll be right outside the door. You have a good rest, Mrs. Season.
Okay. See you later, Jonathan.